Most people expect a painkiller to do one thing, take the pain away. And for a few hours, it often does. Your knee feels a little better. The ache in your hip eases up. Walking across the room doesn't seem quite as difficult, so you take another one the next day, then the day after that. And before long, it becomes part of your routine. A pill with breakfast, a pill before bed, just enough to get through the day. But a few months later, something strange starts happening. The pain keeps coming back. In fact, for some people, it seems to be showing up more often than before. And that's where things get interesting, because many adults over 50 believe that if a painkiller is helping them feel better, it must also be helping their joints. But those are not always the same thing. Feeling less pain and improving joint health can be two very different things. That's the part many people never hear about. Today, we're going to talk about one of the most commonly used pain relievers in the world and why researchers and joint specialists have become increasingly concerned about what can happen when it becomes an everyday habit. Now, this doesn't mean painkillers are evil. It doesn't mean you should stop taking anything your doctor has recommended. But it does mean there is something important happening beneath the surface that deserves a closer look. Because sometimes the thing that makes us feel better today can quietly make it harder to solve the real problem tomorrow. By the end of this video, you'll understand why some commonly used pain relievers may be making joint problems harder to improve, the warning signs many people overlook, what many joint specialists encourage their patients to focus on instead. And if you're over 50 and dealing with knee pain, hip pain, stiff fingers, or aching joints, I encourage you to stay with me until the end. Because one simple habit I'll share later has helped many people move more comfortably and depend less on temporary pain relief. I'm Dr. Juliet, and here, we make health easier to understand so you can take better care of your body, stay active, and enjoy more healthy years ahead. If you appreciate simple health information explained in a way that actually makes sense, take a moment to like this video and subscribe to the channel. Every week, we share practical tips to help you stay healthier, stronger, more independent as you get older. Now, let's get started. A few years ago, researchers started noticing something interesting. Many people with joint pain were doing everything they thought they were supposed to do. They were taking their pain medication, trying to stay active, trying to get through their day, yet their joints often continued getting stiffer, weaker, and more painful over time. That raised an important question. If the pain was being controlled, why weren't the joints improving? The answer starts with understanding the difference between pain relief and joint health. Pain is your body's way of sending a message. It's saying something here needs attention. When you take a painkiller, the message often becomes quieter. You feel relief. You can move more comfortably. You can get through the day more easily. But inside the joint, the processes causing the pain may still be happening. And this becomes especially important after the age of 50. Because aging joints are already dealing with challenges they didn't have years ago. The smooth, protective cartilage inside the joint gradually becomes thinner. The cushioning becomes less effective. Small amounts of inflammation can build up. The muscles supporting the joint may become weaker from years of wear and tear. As these changes occur, the body relies more and more on movement to keep the joint healthy. Movement helps deliver nutrients into cartilage. Movement helps keep supporting muscles strong. Movement helps maintain flexibility. But here's where today's topic becomes so important. Some pain relievers may reduce discomfort so effectively that people unknowingly continue habits that place extra stress on already vulnerable joints. Over time, that can create a cycle that many adults never see coming. Let's see exactly how this cycle begins and why one of the most common painkillers in the world may be contributing to it. Now, before we go any further, I want to make something very clear. If your doctor has prescribed medication for you, keep following their advice. This video is about understanding what's happening inside the body, so you can have better conversations with your healthcare provider and make more informed decisions. With that said, let's talk about one of the most commonly used pain relievers among adults over 50, anti-inflammatory painkillers. You probably know them by familiar names sitting in medicine cabinets all across the country. And here's what makes this topic so fascinating. The concern isn't that these medications don't work. They do work. That's actually part of the problem. Let me explain. Imagine your knee hurts every time you walk around the grocery store. Before taking the painkiller, your body naturally tells you when you've had enough. The discomfort increases. You slow down, you rest. Your body gives you feedback. But after taking the medication, that warning signal becomes quieter. You feel better, you move more, you push a little further. Maybe you spend extra time on your feet. Maybe you tackle that big project around the house you've been putting off. Maybe you climb the stairs a few more times than usual. And because the pain isn't speaking as loudly, you don't realize how much stress the joint is still experiencing. Have you ever done that? Have you ever had one of those days where you felt surprisingly good, stayed active from morning until evening, and then woke up the next day wondering why your joints felt so angry? Many people have. And sometimes that's exactly what's happening. The medication helped reduce the pain, but it didn't magically restore the cartilage. It didn't rebuild the cushioning inside the joint. It didn't strengthen the muscles supporting the joint. The joint still had the same limitations. You just couldn't feel them as clearly. And over months or years, this can become a frustrating cycle. The knee hurts. You take a painkiller. You feel better. You do more. The joint gets irritated again. The pain returns. So you take another painkiller, and the cycle repeats itself. Now here's the part most people never think about. Joint pain is rarely caused by a lack of painkillers. Think about that for a second. The real issues are often things like joint wear, excess body weight, weak supporting muscles, poor movement patterns, stiffness, or ongoing inflammation. Those are the things that need attention if the goal is healthier joints in the long run. And when all our attention goes towards silencing the pain, it's easy to overlook what's actually driving the problem. That's why many joint specialists encourage their patients to think beyond temporary relief. Because the goal isn't just to have less pain today. The goal is to help the joint function better tomorrow, next month, and next year. And there are a few warning signs that suggest pain relief may be covering up a bigger issue. And your first sign is one that surprises many people, because they often mistake it for proof that their joints are getting better. Warning sign number 1, you need more than you used to. Let me ask you something. Think back to a few years ago. When your joints started bothering you, how much pain medicine did you need before you felt relief? Maybe one tablet was enough. Maybe you only needed it once in a while. Now compare that to today. Are you taking it more often? Taking a higher dose? Keeping a bottle nearby just in case? If so, you're not alone. And this may be the first warning sign that your joints aren't moving in the direction you think they are. Many people assume that if a painkiller stops working as well as it used to, the answer is simple. Take a little more. Take it a little more often. Switch to a stronger version. But that's like turning up the volume on your television because someone is knocking on your front door. The sound gets louder. The message doesn't go away. The knocking is still there. Your body works in a similar way. When a joint continues to wear down or become irritated, the signals coming from that joint often become stronger over time. The body is essentially saying, hey, I still need attention here. And if you're finding that you need more medication than you used to just to achieve the same level of comfort, that could be a sign the underlying issue is continuing to progress. Someone once said, I used to take something only after a long walk. Now I take it before the walk, during the walk, and sometimes afterward too. That wasn't a medication problem. That was a clue that the joint itself needed more support. And here's something worth thinking about. Have you ever noticed that some people seem to have surprisingly healthy joints well into their 70s and 80s, even though they don't rely heavily on pain medication? It's usually because they've focused on protecting the joint itself. The muscles, the mobility, the daily habits, the things that influence how the joint functions. That's where lasting improvement often begins. Because pain relief can help you feel better, but stronger joints help you live better. And there's another warning sign that's even easier to miss. In fact, many people see it as good news. They think it's proof their painkiller is working perfectly, but it can actually be a signal that they're accidentally putting more stress on their joints than ever before. Warning sign number 2, you're doing more, but feeling worse later. This next sign catches a lot of people off guard, because at first, it feels like a victory. The medication kicks in, your joints feel better, you have more confidence, you get things done, you clean the house, work in the garden, take that longer walk, run errands, maybe even play with the grandkids longer than usual. And honestly, who wouldn't want that? Feeling capable again feels wonderful. But here's the question. What happens later? Not during the activity, not while the medication is working. What happens that evening or the next morning? If you regularly find yourself thinking, why am I hurting so much today? After a day when you felt great, your body may be trying to tell you something. Remember, pain is feedback. When that feedback becomes quieter, it's easier to accidentally push beyond what the joint can comfortably handle. The medication may make movement feel easier, but the forces passing through the knee, hip, or ankle haven't magically disappeared. And when those forces exceed what the joint can comfortably tolerate, irritation can build up. That's why some people end up trapped in a frustrating pattern. Good day, pain flare, recovery day, good day. Pain flare, recovery day. Over and over again. And eventually they start wondering why their joints never seem to make lasting progress. The answer is often that they're managing symptoms without giving the joint the support it truly needs. Which brings us to another warning sign. This one is perhaps the most important of all. Warning sign number 3. Your joints are getting stiffer, not stronger. Let's do a quick mental check. When you get out of a chair, is it easier than it was a year ago? When you climb stairs, do you feel stronger? When you bend down to pick something up, does your body move more freely? Or do you feel like you're gradually losing ground? Because that's the difference between relief and improvement. Relief changes how you feel. Improvement changes how you function. And function is what really matters. One of the biggest mistakes people make is measuring their joint health only by pain levels. But pain is only part of the story. A joint can hurt less while becoming weaker. A joint can hurt less while becoming stiffer. A joint can hurt less while losing mobility. That's why specialists often pay attention to questions like, can you walk farther? Can you stand longer? Can you move more easily? Can you maintain your independence? Those are signs of a healthier joint. Now think about your own situation. If you've been relying heavily on pain medication for months or years, but your flexibility continues shrinking, if getting out of bed feels harder, if your balance feels less stable, if your range of motion keeps decreasing, then your body may be telling you that pain relief alone isn't enough. Because healthy joints need more than symptom control. They need movement. They need strength. They need support. And the encouraging news is that many of those things are still within your control. In fact, some of the most effective strategies for supporting aging joints have nothing to do with taking stronger medications. Because once you understand what actually helps joints stay healthier over time, everything starts to make a lot more sense. What many joint specialists recommend instead, since the goal isn't simply to reduce pain for a few hours, but rather to help your joints stay healthier for years. So, for people who want to keep moving, keep traveling, keep gardening, keep enjoying life, joint specialists often focus on 4 things. Just 4 simple areas that make a big difference over time. The first is movement. Many people are surprised when they hear this, because when a joint hurts, the natural reaction is to protect it, to sit down, to avoid using it, to move as little as possible, and in the short term that can feel like the right decision. After all, if walking hurts, resting seems logical. But here's something we see all the time. A person starts moving less because of pain. A few weeks pass, then a few months, and suddenly they're even stiffer than before. Their legs feel weaker. Their balance isn't what it used to be. Getting out of a chair becomes more difficult. Not because they're getting older overnight, but because the body adapts to whatever we ask it to do. That's why joint specialists often encourage gentle daily movement. Not because movement cures everything, but because movement helps joints stay alive, active, and functional. Even a short walk around the block, a few minutes of stretching, a simple chair exercise routine. These small actions can help keep the joint from becoming trapped in a cycle of stiffness and weakness. Best movement isn't necessarily the hardest movement. It's the movement you'll actually do consistently. The second thing is building muscle. Let me ask you a question. If you were carrying a heavy box, would you rather have one person helping you carry it or 4 people? Most people would choose 4 because the weight gets shared. That's exactly what strong muscles do for your joints. Your knees are not supposed to do all the work alone. Your hips aren't supposed to carry every load by themselves. The muscles around those joints are designed to help, to absorb force, to provide stability, to protect. That's why specialists often say, stronger muscles can make life easier for sore joints. I once heard an orthopedic specialist explain it like this. He said, "We don't just treat knees, we treat the muscles around the knees." And that's a powerful way to think about it. Because many people spend years focusing on the painful joint while ignoring the muscles that support it. Simple strength exercises can make a remarkable difference over time. Chair squats, wall push-ups, standing leg raises, light resistance exercises. Nothing fancy, nothing intimidating, just gradually teaching the muscles to do their job again. And when the muscles become stronger, many people discover they feel more confident moving through everyday life. The third thing is lowering inflammation. Now let's talk about something that's often happening quietly in the background: inflammation. Think of inflammation like a small campfire. A tiny campfire can be useful, but if it keeps growing day after day, eventually it starts causing problems. Many things can add fuel to that fire: poor sleep, chronic stress, carrying extra weight, highly processed foods, not moving enough. And when inflammation stays elevated, joints often feel the effects: more stiffness, more swelling, more discomfort. That's why specialists increasingly look beyond the joint itself. They look at the whole person. How are they sleeping? What are they eating? Are they drinking enough water? Are they active? Because joints don't exist in isolation. They're part of an entire body. Sometimes improving sleep alone can make a noticeable difference. Sometimes losing a small amount of weight can reduce pressure on the knees. Sometimes better nutrition helps calm the body's inflammatory response. These aren't overnight solutions, but they are powerful long-term investments. The fourth thing is listening to the body. This may be the most overlooked recommendation of all. Learning how to listen to your body. Many people fall into one of two extremes. They either ignore every signal, or they become afraid of every signal. Neither approach works very well. Your body is constantly giving you information. The question is whether we're paying attention. Maybe your joints feel better after a morning walk. That's useful information. Maybe sitting for 3 straight hours makes you stiff. That's useful information too. Maybe a certain activity consistently leaves you sore for 2 days afterward. Your body is telling you something. Joint specialists often encourage people to become curious observers. Because when you start noticing patterns, you can make smarter decisions. You begin working with your body instead of constantly reacting to symptoms. And over time, those small adjustments can add up to something remarkable: a stronger body, better movement, greater independence, and a life that's less controlled by joint pain. Before we finish, I'd like you to do something simple. Take a moment and think about your joints 1 year ago. Not yesterday, not last week, 1 year ago. Now ask yourself these 3 questions. Can I walk farther today than I could a year ago? Can I get up from a chair more easily than I could a year ago? Can I move with more confidence than I could a year ago? If your answer is yes, that's wonderful. You're likely doing something right. Your efforts are paying off. But if your answer is no, don't get discouraged, because today may have revealed something important. Pain relief and joint improvement are not always the same thing, and sometimes the first step toward better joints isn't finding a stronger painkiller. It's understanding what's actually happening inside the joint. That's why I'd love to hear from you. Which joint gives you the most trouble right now? Your knees, your hips, your lower back, your shoulders? Leave your answer in the comments below. I read as many comments as I can, and your story may help someone else realize they're not the only one dealing with these challenges. While you're down there, tell me this too. How often do you take pain relievers for joint pain? Every day? A few times a week? Only occasionally? I'm genuinely curious. Because the answers help me create videos that address the real struggles people are facing every day. If you found this video helpful, please give it a like and subscribe to the channel. Here, our goal is simple: to make health easier to understand and easier to act on. Take care of yourself, keep those joints moving, and I'll see you in the next video.